Well, the school year is either here or quickly approaching. So how might that affect coronavirus cases as kids head back to the class? Joining us now is Dr. Dan Shirley, Medical Director of Infection Prevention at UW Health, the perfect guy to talk to on this Tuesday afternoon. All right, let's start with first things first. Give us a quick synopsis on where we stand as of today in terms of rate of infection, severe illness, things like that.
Well, the good news is cases pretty much everywhere are headed downwards. There's still a little caution because the cases are still pretty high, but overall cases are going down. For a while now, the severe cases and death has been headed downwards and stayed fairly low. So all of that's pretty good news.
Heading in the positive direction. That's what we like to see. You know, kids, of course, they are heading back to school this week in a lot of districts. Most are mask optional. Do you expect to see an uptick in COVID cases?
Yeah, I think anytime we're talking about people getting in groups, especially going into the fall and winter, those are the risk factors for all respiratory viruses, including COVID. So yeah, I think for kids, but also as adults get into groups and inside more, we expect to see some rise in cases. Obviously, that's influenced by lots of other things too, about booster shots and other interventions that people do.
We'll talk about those boosters in a second. Do you feel more confident this fall going into the new school year than you have the past two falls?
Well, I think things are a little bit more known, at least, the things we can do to prevent things and just general awareness about COVID and the things we need to do. I do think that we'll see some rises and falls in cases still. I think we're hopeful that this is spreading out so it's a less frequent, rise and fall, as it were.
Let's talk about those booster shots. Those updated boosters are expected to be given the green light soon, the ones that are Omicron specific. Do you expect to see an impact with this additional booster when it comes to case counts, hopefully bringing them down?
Well, I think we found from previous booster shots that it does have an impact like that for a period of time. But the most important thing, and really what the vaccines have always been focused on, is preventing that severe disease and death. I think right now we don't really know exactly what's going to happen with this extra, more focused Omicron booster, besides that we think a booster will be helpful as people go into the fall. It's about time for most people to be thinking about a booster anyways, and we think it's good that we have a more specific one right now.
And this more specific one, it's already been given the green light overseas. I'm assuming that scientists and researchers and doctors alike have been watching what's been happening over there and seeing the data and tracking it.
Yeah, this process is happening both quickly and as we speak. So I think this week there might be a review, or at least in the next couple of weeks, we'll hear more about the approval of this Omicron-specific version, which is paired with the original version too. And it's really just kind of a tweak to the previous booster. So a lot of the data is expected to be similar.
And similar to how the flu shot works, right? Like every year, it's just a little different.
Yeah, exactly. At least in a theory, that's what we kind of anticipate here, is that there might be some tweaks. Obviously, for COVID, the variants have been coming faster than every year, and so the tweaks have needed to change more quickly.
We just turn and adapt as we do. Dr. Shirley, we appreciate your time. Thank you.
Thank you. Yep.